Good evening, everybody. I think we've got everybody here from the chat room. I'm going to quickly introduce myself. My name is Susan McElnay. I'm Business Director at Lincolnshire Training Hub. Could I just ask that everybody puts their devices on mute, but put your cameras on. We're happy to see you. I know it's late. I'm sure that nobody's in their pajamas quite yet, but put your videos on so we can see you. But if you can just, if you've got any questions, pop them in the chat until the end. That would be really helpful. My colleague Ruth Pollock from the Training Hub in Lincolnshire is here as well. And our presenter tonight is Georgina Craig, who's joining us from Redmoor ELC. And we will be discussing video group consultations, video group clinics. So just to thank everybody for their time, and I hope you enjoy the session. Just a quick reminder that it's being recorded. So if you're uncomfortable with the recording, please keep your cameras off. Thanks so much.
No problem. I can hear a little dog barking in the background there.
He's mine. I'm going on mute and then you'll be left in peace. Apologies.
No problem. Okay, so welcome everybody to this sort of half an hour or so briefing on video group clinics. This is aimed specifically to you guys as new practice fellows. So I'm going to set up this session in the same way that we would set up a video group clinic, and that's useful because it helps you to get a sense of the process. So over the course of today's session, which is going to be around about half an hour, we're setting up the session now. We're doing a little welcome, then we'll have a little bit of an explore around what video group clinics are. I'll explain some of the tech and the IG requirements for you, how they flow, the workforce that you need to engage in order to run video group clinics, and also highlight some resources to help you. And I'm aiming to close just around about 8 o'clock. So whilst we work together in a group here in our virtual room, I'm going to ask you to sign up now to some understandings so that we can work really well together. So the first thing is to be in the room. So we really appreciate the fact that you've joined the early evening. I was just saying to the team that actually, I'm so impressed with your dedication to be here at 7:30 at night. That's wonderful. So whilst you're here in the room for the next 30 minutes or so, let's be here. Try to avoid looking at your mobile phone or getting distracted. Stay really curious and respect different perspectives. You might hear things tonight that you're a little bit, kind of dubious about or don't really quite believe can be right. So let's just be open to learning. If we were in a video group clinic now, we would also ask the group to respect confidentiality. This wouldn't be the only way that we would secure confidentiality, but it is one of the ways. And we would also say no recording to the group as well, for them and for us. Now tonight we are recording, so that one doesn't quite apply, but it's just to show you the understandings that we use. We would also ask everybody to mute their microphones just as you have, and it would be really great if you could use the chat tonight so that you can post questions for me in the chat, and then we will also have a bit of group discussion a little bit later when I finish presenting. Don't worry about spelling mistakes. That's a really important one to have as a group understanding in your actual group clinics, because we don't want patients to feel embarrassed because perhaps their spelling's not up to scratch. It's also actually realistically quite easy to make spelling mistakes when you're typing quickly in the chat. So it's just a way of saying to people, it's absolutely fine, don't worry if you're not feeling that confident about your spelling. And should any of your technology not work tonight for some reason, you can't hear me or whatever, just drop a message into the chat and let us know. And if this was a real group clinic, then we would also say we would rebook you at another time. We're going to keep to time. Usually if I was running a group clinic, I would have a facilitator. Today my facilitator is my iPhone, and I'll just be keeping an eye on the time and making sure that it's okay. Is there anything else we want to add? If there's another thing that you can think of that would help us to work better together as a group, just pop it into the chat now so that we can all see that. And whilst you're doing that, I'll just also introduce the idea of the car park. So the car park is a facilitator tool that we use in a group clinic. It's really helpful whenever you're managing any kind of group and there's a dynamic to be managed. It's a really well-established facilitator tool. And what we're going to use the car park for tonight is if some of you ask questions that maybe we don't know the answers to, or maybe if we're running out of time, we'll use the car park to help us to manage time and to deal with anything unexpected that might come up. And I'm just going to demonstrate to you how we use the car park. So it's a virtual car park we're using. And if I were to be wanting to write something in the car park, I pop it in to the chat with a little prefix that says car park. Hopefully you can see that. So that's how we're going to work today. And it's also how we work in a group clinic. So what are video group clinics? Well, they're an alternative way of video consulting with a group of patients, but rather than seeing each patient individually, you do your individual clinical consultations in a supportive peer group setting. So those of you who've been starting to get into the swing of doing some reviews in general practice, doing some work in general practice, will know that when you've got a group of people who've all got similar clinical conditions or problems, or you're undertaking QOF reviews or etc., often you will find yourself repeating yourself a lot. And the benefit of a video group clinic is you don't need to repeat yourself, because people pose their questions, and often those questions are the same, and you're able to manage that and have a little bit longer to spend exploring the answers to those questions with the group. An interesting aspect of a group clinic is that there's a facilitator who supports the clinician, and that's really important. You really need that facilitator. It makes sure that the group clinic is actually sustainable, and it's also a great development opportunity for some of your non-clinical staff. So that might include HCAs, it might include social prescribers, health coaches, etc. And what we find is that the people who really excel as being facilitators make a huge difference to the practice's ability to deliver group clinics. So actually, from the clinician's point of view, it's actually really business as usual. You kind of just rock up and all the hard work is already done, and you just do your clinical work with the patients, because you're only there about half of the time. And when we're talking about a video group clinic, you have to choose the platform to deliver group clinics on. About 80% of people are delivering group clinics on MS Teams because it's an NHS approved platform, but there is a choice, and you can access information to help you to decide the best platform if you want to move away from MS Teams. Excuse me. So what they're not is a webinar. So today is really more like a webinar. It's probably less interactive than a group clinic. They're not a group education session, because you do have the opportunity. It's actually really the patients who set the agenda. Whereas at a group education session, which would be something more like a Daphne or a Desmond diabetes session, there's a predetermined sort of set of information that the patients get communicated by the person or the team who are supporting them. Whereas a video group clinic really starts almost with a blank agenda, and the patients decide what it is they want to talk about. That's managed a little bit by bringing some focus through something called the results board, which I'll share with you later. It's actually not a virtual self-help or peer support group, but as part of the sort of experience of the group clinic, clearly people do get peer support and a lot of help and advice from their peers. And it's not an expert patient-led intervention. However, again, often expert patients emerge within group clinics and have and make massive contributions to the group clinic. And that's in some ways the beauty of it. It's about the wisdom of the group, as opposed to that one-to-one consultation where you've got the wisdom of the clinician and the wisdom of an individual patient. You're getting the wisdom of a lot more people to help you to problem solve and help you to move forward with managing your condition. It actually grew out of group therapy, and this is a story that not everybody is aware of. So post World War II, there was a really big demand for psychotherapy, and lots of people suffering from PTSD as a result of the war. And there weren't enough clinical psychologists and psychotherapists to go around. And so group sessions was how they decided to respond to that. And it's interesting that now we find ourselves in a world post-COVID where we've got huge backlogs and really big, demand on primary care. And maybe now, as Susan was saying earlier, is perhaps our moment to really think differently about how we consult with patients. So excuse my slides going all over the place here. I'm not quite so used to Zoom as I am to stop already to Microsoft Teams. So in our new service visit, this new strange world that we're all working in, where we've got this mix of virtual and face-to-face, how do virtual clinics fit in, virtual group clinics? Well, it provides you a way with offering socially distanced peer connection. We are now starting to have conversations about face-to-face group clinics, but I have to tell you that if I was a patient who was living with a long-term condition, I would still feel quite uncomfortable about the idea of being in a group clinic with a lot of other patients who also were quite vulnerable. So I think that video group clinics are going to be here to stay for a little while yet. And actually, we've got certain groups who actually prefer the video model. It provides a lot of clinician flexibility, so it allows people to self-isolate, which is obviously still an issue, and also supports retention by offering the option of home working. And it's going to help us to offer planned care and chronic disease management reviews, regardless of what happens over the winter into next year. I mean, COVID's just not going away, is it? You know, we are going to have more lockdowns, or at least sort of restrictions. So, you know, it's a really resilient way of delivering really person-centered care. I also thought I'd mention the new Pcn contract, which some of you may be aware of. So the Pcn contract has a number of sort of elements that group clinics could help to deliver. So there are access targets around online consultations. There's also the need to reduce 2-week waits. Group clinics can really help to reduce waiting times, and they also obviously are a form of online consultation. There is a huge challenge that PCNs are going to face delivering the cardiovascular diagnosis and prevention part of their contract, which requires that anyone who has had a high blood pressure reading even thousands in bigger practices, and hypertension lends itself really well to a video group clinic model. Personalised care is ever increasingly coming to the fore, and group clinics really help deliver personalised care. Our clinical pharmacist colleagues can do their structured medication reviews and medication optimisation in group clinics. QoF lends itself really well to group clinics. In fact, QoF compliance increases through group clinics. So as well as it also being more efficient from clinician time, it actually is going to generate money for general practice, a really good argument to use with your partners. And also we've got the long COVID days, which has money attached to it, and that we are finding lends itself really well to group clinics too. It's also a great opportunity for workforce development and leadership development and retention. And from your point of view as fellows, potentially group clinics could be a really fabulous way of helping you to integrate into your practice, because they require you to work with everybody. So one of the things I'm going to encourage you to do is think about making group clinics your sort of improvement project as part of your fellowship. So what about Oh, the recording has stopped. I don't know if that's what was intended.
Apologies, Zoom has just kicked me out, so I'll start recording it.
Okay,
I'm back in.
So no problem. The screen, if you're okay, if you are going to be looking at records during the group clinic, which to be honest, I would probably suggest you didn't, then it's safest for there to be a dual screen for the clinician, so you can access the patient's records on a separate screen, just to avoid any kind of so Zoom is working really hard to make itself into a platform that the NHS approves. So things are changing all the time, and we have an online guide to help you with this and help you to make your choice. There are a number of clinical and IG risks that you have to mitigate against. So the first one is making sure you know where the patient is. And the main reason for that is that, you know, if they were taken ill during the group clinic, you would need to know how to get in touch with them. So in advance of the group clinic, they share their likely location on the day, on their telephone number on the day that you can reach them on. And you also ask them to come up with a password, which helps you to check their identity without asking them personal questions and sharing personal information within the group. So we have processes set up to manage all of these risks, and those have been approved by NHS England and also NHS Resolutions, which is your indemnity provider for all the clinical work you do. So it's all been signed off, it's all safe. The processes are really robust. The patients also have to consent. They have to consent to share some of their clinical data in the group clinic, and they have to also sign up to keeping what they hear in the group clinic confidential. So it's that what we hear in the room stays in the room. And that is all sorted via a process that we show you how to implement, which starts before the group clinic and is also reaffirmed in the group clinic itself. This is how a video group clinic generally flows. This is also the flow of a face-to-face group clinic. So as you can see, it's quite similar to the clinician is only there for half of the time. The whole session lasts 60 to 90 minutes. Our clinicians who have got lots of experience in video group clinics are telling us that actually 60 minutes online is enough, whereas face-to-face, people can kind of go for a bit longer and enjoy a bit of a longer session. But you know, it's quite tiring, isn't it, being on the computer? So that's really good. And notice that before the clinician arrives, patients decide their questions, and after the clinician leaves, patients set goals. So in that way, it very closely mirrors care and support planning. I'm going to give you some examples of some results boards. The results boards are really important because they really provide focus. They also make sure that you tick all of the boxes for QOF. So this is a diabetes results board. Diabetes is a very kind of biometric driven group clinic model. Yeah, because there were very clearly defined care processes and biometrics that need to be reviewed every time you see the patient. Notice that all the patients have their first name only, but we do share those results. And also notice the normal levels down the bottom so people can compare themselves with the norm. And what this does is often this is the very first time that patients have really truly understood how they deviate from the norm. And that's what then makes them ask some really valuable questions and feel motivated to change and take control of their condition. And then others who are closer to the norm can share what they've done and how they've managed to improve the management of their condition. This is a lower back pain video group clinic results board. So a little bit more holistic, a little bit more focused on lifestyle change, because lower back pain, the main interventions are lifestyle based, but also bringing medication into the conversation with a view to potentially reducing long-term prescribing of opiates as part of the intervention. This is a pre-chemotherapy discussion board. So this is sort of much less focused on biometrics. And this is the sort of themes that people, the sort of things that people want to talk about before they have chemotherapy. And this provides focus and stimulates patients to think of their questions. And we also are working with social prescribers and health and wellbeing coaches to run wellbeing assessments and reviews. And this is a results board from a wellbeing assessment and review, where they have used a little traffic light system of smiley faces, etc., to help people to work through how they need to improve or want to improve their well-being around the 5 ways to well-being. So it's a very, very flexible model. So there are 3 key roles in a video group clinic, and these are the key roles. The clinician, in many ways, is actually just doing what the clinician has always done. The difference is that the clinician probably is more in a mode of reflecting people's questions back to the group and asking the group to solve their own problems rather than answering all of those questions as the expert in the room, thus using the wisdom of the group. The technical facilitator sets up the session, does all of those identity checks and everything. So by the time the clinician arrives, whoever's there is all set up with their IT, don't need to worry about any of that, and they can just do their clinical work. And the agenda has already been set because the patients have already posed their questions. And then we have the clinic coordinator. And one of the challenges in the early days of setting up group clinics is undoubtedly the admin that needs to be put in place to help the practice to work this way. So booking people in, having a slightly different way of communicating with patients, selling the benefits of this way of working to patients, all that kind of thing. But once you've got it up and running and it's working, you know, you can very rapidly expand this way of working to a whole range of different clinical issues. We also know now that in order to facilitate the adoption of this at PCN level or cluster level, you need to have a number of different people championing and working on this. So the first one is your clinical champion. That's likely to be a well-established GP or nurse who has a bit of clout in the PCN. Then you need a manager champion. So that's going to be a practice manager who, again, has a bit of clout and has a bit of influence. But then you need somebody to act as a change maker. So that's the person who's going to really kind of drive the change and make it happen. And that is something that I believe that New to Practice Fellows could take on. So it's not about you being, it's about you working in partnership with an established influential clinician and manager to drive this change, but you saying, putting your hand up and saying, I'm prepared to step up and make this my project, and I've got some headspace in order to take this on. And that is really what is needed to make this a success. So that person drives the change, needs to be enthusiastic about video group clinics and have some headspace. And it's a great way of developing your leadership skills. So just ask yourself, perhaps, could you be a change maker within your PCN as part of your fellowship? If so, I know that Susan's probably going to share after I finish talking that there may be a bit of resource to help you to do that. If you want to find out more, then we have 2 e-learning modules, and I'll be very happy to share the link to sign up for them. They're on e-learning for health, and they give you another sort of 2 modules of about 20 minutes each, with lots of background about the evidence base for group clinics, but also the process of how group clinics work. And this is our website, and we have masses of case studies. We run monthly webinars, and you can listen into those webinars, come along, talk to clinicians who are actually doing group clinics and learn from them. And you'll get very excited and motivated by listening to them. So here's our email address if you want any more information from us. And if you can't see any questions in the chat, but if anyone has got any questions, if we've got a few minutes, you want to kind of like unmute and ask them, and I'll kind of hand back to you, hopefully, Susan.
Yep, thanks so much, Georgina. I had a quick question. I'm conscious that we have colleagues here from both Lincolnshire area and also Northamptonshire. So I'm conscious that I don't want to overtake it with regards to what's happening in Lincolnshire, because we have both our colleagues here, and I know that different things happen in different areas, but absolutely food for thought regarding the detail and the support. What really struck me was, you know, those three sort of champions and people that you need, and also to say that in both areas, your training hub is completely supportive of what is happening here, regardless of which area you come from. I know that in Lincolnshire specifically, we've had some really positive news with our, we have a new workforce transformation GP team supporting our GP fellows and our GPN fellows, and also the CCG and SCP have trying to allocate some resource so that we can really, launch this well. And have some really good learning. I know that we have appetite from a few fellows, doing this as their project, as the way to link in to their system, working closer with their PCNs and their practice, and then sharing that best learning across patch, which I think is the beauty of the fellowships, really having the protected time in which you can work on this project alongside obviously your very busy days in practice as well.
Absolutely. So on Northamptonshire, I'm also having conversations with the with a number of different people in Northamptonshire. So I've put my email into the chat, and if you are in Northamptonshire and you're keen to learn some more, I will connect you with the people within Northamptonshire who are taking this forward. So if you want names, Dr. David Smart is the person, one of the people to speak to in Northamptonshire about this, or Susie Dion. But just get in touch with me if you're in Northamptonshire and you're keen. And I know we're going to keep in contact, Susan, aren't we, to talk about moving this forward in Lincolnshire. So, I would just say to you, if of all the things that I've done in my whole career, I've worked with the NHS. I'm not a clinician, but I've worked trying to make change in the NHS it's a bit scary, over 30 years. And I was involved in piloting things like the minor ailments scheme in community pharmacy, sort of about 15 years ago. We did the first pilots of that when I was working for a community pharmacy organisation. But this is, to my mind, the most transformational way of giving us what we desperately need in the NHS, which is a different way of supporting people who live with long-term conditions. Our system and our consultations are designed for acute presentations, and that is not what we have. The majority of our workload is now managing and supporting people to keep well themselves, and the group clinic model is just perfectly designed for that.
Hi, can I ask a question, please?
Of course.
Hi, I'll just turn my video on. Hi there. Hi, thank you so much for the talk. My name's Aubrey. I'm actually a GP fellow in Northamptonshire. I'm really keen on this idea. I actually attended your, there was an NHS England run training session for this last year in September, and I ended up going to that. But unfortunately, I've done quite a lot of background work to try and get this set up, but for various reasons, we've not been able to set it up as of yet. Due to workforce issues and also and other issues. However, I'm really keen to get this sort of running in our PCN. And one of the questions I had was, is there any possibility that I could attend a real life video consultation session where I'm there as an observer? I'm just sort of keen to see, how much the clinician says and what sort of changes they're making, particularly to some of the conditions I'm thinking about of setting this up. And I wondered whether there is any possibility to do that, because I know obviously these aren't recorded.
Yeah,
sessions.
so I mean, what I would say to you, Harpreet, is I can probably find somebody, but just bear in mind that the number of people running group clinics is relatively small compared to probably the number of people who aren't. And it's one of those things where it's like, let's help you to run your own, and then you'll experience it. Do you know what I mean? Because much as it is great to sit and watch, and I know it is a big part of the way that we work in healthcare is to sort of see one, do one. You know, it's you know, you can very quickly get going with this, and I would rather put you in touch with David and Susie, and see if we can get you involved in the programme in Northamptonshire and get that going. I would also say to you, come along to some of our webinars that are free. We run them on a monthly basis, and you can talk to the clinicians who do it and get their feedback. Do you know what I mean? That's sort of the second best, I think, is, you know, because I can say all this stuff, but actually it's not as powerful as when you hear it from the horse's mouth, you know. So, you know, they're run on a lunchtime, but also on our website, they're all recorded. You know, we post all the highlights. So if you've got a few, you know, 10 minutes spare, you can just go and watch one quickly and just get a feel for it. What areas are you looking at, just out of interest?
So we were looking at sort of hypertension, and the other area we were looking was diabetes. So those were two sort of areas that we were looking at.
Yeah, both perfectly suited to group clinics.
Yeah,
really.
but I guess the other sort of thing I'd sort of heard of, we've got a new social prescriber on board who's quite, who I'm hoping to try and work with, and I wonder sort of, I've heard of sort of colleagues in different areas outside of Northamptonshire who've set up sort of these clinics with social prescribers. So yeah, so I think, yeah, we're sort of seeing how we can try and set these up. It's just, I think the workforce and the planning, that's probably the thing which probably was sort of the difficult part, but now with the fellowship I've got some time and some headspace to try and really work with that and try and
that's amazing. So I know that in Northamptonshire they are keen to look at in particular sort of how to involve the personalised care workforce as well, so that fits really well if that's something your PCM will be interested in. So you can either post your email in the chat and I will pick up and connect you, or
that'd be great.
Send me an email afterwards. I've popped my email in the chat, and then I'll make sure you get connected.
Brilliant, thank you so much. Thank you so much for time. That's great.
Problem.
Thank you.
Do we have any more questions from anybody on the call? Nothing in the chat, Georgina. So I think that's us for the evening. I just want to thank you again for coming along. Really informative. I know that these sessions are short, and we appreciate everybody attending on, you know, probably what's been a very busy day for everybody. So just to say thanks a lot, and we look forward to meeting with everybody again next month when we talk about another subject. Thanks, Georgina.
I'll send my slides as well so that you can
circulate
them. All right, take care, everybody. Have a lovely evening.
Thank you.
Take care. Bye.
Bye.